there's no question that fasting has a role for many people.
Thank you. So I'm going to have the audience ask a few questions. So I'm going to start off with David R. David R., please state where you're from and state your question.
Hi, this is David from Massachusetts, and I have two quick questions. So first of all, regarding the salt, what are your thoughts about potassium chloride as a salt substitute? And the second question, can fasting reverse or improve soft plaque blockage in the blood arteries? Thank you.
Okay, what was the second? I didn't quite get the last part of the second question.
The second regarding fasting, is there any evidence that fasting can help improve or reverse blockage in arteries, in blood arteries,
yes,
especially soft plaque?
Okay, so the first part of your question, I'm sorry.
Potassium chloride. Potassium chloride.
Yeah, so potassium chloride is a very good question. Potassium chloride is used as a salt substitute. Unfortunately, in studies that try to compare, does it work better than using salt? The answer is no, and it turns out the chloride itself has contributing factors to some of these difficulties. The reason I don't like it is you never neuroadapt to a low-salt diet if you keep using these salt substitutes. And what we want people to do is get to the point where they don't want the extra salt. That when they go out and eat soup at a restaurant, they don't even want it because it burns their mouth because they've neuroadapted a healthy diet. That happens after fasting. You eat chard and you think, oh my gosh, this is so salty. It's the same as it was before, but now you can actually detect it. So as long as you keep putting in these salt substitutes, you'll never really adapt to where you'll really enjoy a whole plant food diet. And if you don't enjoy a whole plant food diet, it's unlikely you're going to stick to it. Now, as far as reversing atherogenesis, Dean Ornish in Lancet 1980 published one of the first papers showing that coronary artery atherosclerosis could reverse. And, there's pictures there over 32 months, dietary change alone, reversing significant reversal of coronary artery disease. So that was kind of breakthrough stuff. And we believe that that happens even more quickly in fasting. The reason we believe that is because we see the effects clinically. Now, we don't have data to publish on that because we won't do coronary arteriograms in our patients because there's a small mortality consequence. We don't want any of our patients getting screwed up with our testing that's unnecessary. So we're glad that other people are doing that kind of testing, but we won't actually recommend it on our patients. Now, there's going to be other not less invasive procedures like MRI perfusion studies and stuff that we may be able to get involved with to kind of prove this. But we're satisfied ourselves clinically because, the angina, all the related symptoms reverse, the blood lipids reverse, clinically it reverses. We're pretty sure that if we can get in there and non-invasively evaluate coronary artery disease, we'll be able to show that it's reversing as you would expect, because part of the correlation is with how much visceral fat's being mobilized. So if you get the visceral fat off, some of that's coming out of the vessels. And we know that it reverses with diet. We suspect it reverses with fasting more quickly than diet. But regardless, as long as you're willing to do the diet as a consequence of the fasting, you're still going to get well, whether the fasting speeds it up or not.
So I just want to follow up on the question about potassium chloride. I actually asked Dr. Michael Greger about this last year, and you said something about it doesn't work better. What would working better mean? And
well, in terms of treating blood pressure.
Okay.
So there wasn't a substantial improvement, at least in the papers that I saw, when they substituted potassium chloride for sodium chloride.
Oh, okay. So it wasn't the sodium then. You're saying so it may be the chloride.
It is the sodium, but there's other things besides the sodium, including the chloride itself, that you still have in potassium chloride that seems to have a detrimental effect. And also, part of the effect of the sodium may be the stimulation of the overeating, and potassium chloride may still have the stimulation of the passive overeating that the sodium chloride does. So it may not just be the sodium itself that's having the problem. You've got to be careful that association doesn't mean causation. And so just because higher sodium intake results in higher death rate doesn't necessarily mean it's the sodium, but it may be the consequence of the sodium. And the consequence of potassium chloride may be exactly the same as sodium chloride when it comes to overeating.
Well, thank you for that clarification. So next question is going to be thrown out to Joe W. Please state where you're from and ask your question.
This is Joe from Arizona. Thank you, doctor. Do you do colon cleansing, enemas, or colonics during your fast? And if not, why not?
So we do occasionally do some colon cleansing, but generally we try to avoid it. And 98 or 99% of the time we can avoid it by doing careful pre-feeding before the fast. If we can get people to eat properly before the fast it becomes unnecessary. And it's detrimental in the fact that it stimulates the autonomic nervous system. It can leave bowels sluggish post-fasting. The stool is mostly autonomic nervous tone and bacteria. And so, if we feed properly before the fast, most people's bowels evacuate spontaneously. We don't have to intervene and do bowel laundry stuff. But there are exceptions, and there are some people that have particular problems with impaction issues or autonomic tone. And in those cases, we'll use a colonic or, if necessary, an enema or other type of intervention to make sure that we aren't going to have unnecessary problems.
Great. Thank you.
Thank you.
Keep in mind, though, that the bowels are not a principal source of detoxification. Everything in the bowel is stuff that never got in the body. The detoxification in fasting is not from the bowels. It's from the blood being purified by the kidneys and eliminated in the urine. We're much more concerned about the urine as a source of detoxification. That's why we emphasize hydration. We minimize 40 ounces of pure water a day. We're monitoring urine function and specific gravity, et cetera. So the bowels is basically bacteria, stercoble lineage, and a few undigested materials. It's really a secondary issue, and it's designed to have material in it constantly. Your bowels constantly being populated. So the idea that you're auto-absorbing from the bowels is a bit of a misnomer.
Okay, so the next question is going to be Regina. Regina H, please state where you're from and ask your question. Regina, can you hear me?
Oh, yes, I can now. Sorry. I'm from Frankfort, Kentucky. My question is, doctor, does fasting help with nerve? I have undiagnosed nerve damage I don't know if it's damage, but in my legs.
So you mean
does
like the
it help
vessels in your
anything?
legs?
The nerves in my legs, yes.
Right. So fasting appears to have a positive effect on circulation throughout the body. In fact, we're interested in doing a study looking specifically at the vessels in the eyes that we also expect to be impacted by fasting. And there's a non-invasive way of measuring that, and we're hoping we can do a study. We haven't been using diagnostic ultrasound yet, so we haven't been doing like flow studies, which we would like to do. Once we get the $100,000 it costs to get the machine, we'll be able to start evaluating that. So there's so much stuff that we want to do that we haven't been able to do yet. We've had a particular agenda showing fasting safety, looking at the more acceptable interventions in coronary artery disease and diabetes, and then publishing case reports that are, outliers that people wouldn't normally think of. Some of these really fundamental issues like measuring flow and stuff, definitely need to be done. We just haven't quite gotten to it yet.
Okay, thank you.
What I can tell you, though, is patients coming in with intermittent claudication and the symptoms of vascular compromise have dramatic, consistent across-the-board improvement. It's really quite remarkable where they come in, they can't walk, and then by the time we're done fasting, they're able to go out and do prolonged walking. Clearly, clinically, the results are there. We just have to kind of get the objectives to prove it.
Thank you for that, doctor. So regarding mental health, your book suggests fasting can have positive effects. What mechanisms underlie these improvements?
So the two conditions that are most common in our society is anxiety and depression. And there's a really interesting little book out there called Anatomy of an Epidemic, which is written by a researcher that points out that the debility that comes from depression has dramatically increased since 1986, coincidentally around the time that Prozac was first introduced. We began treating depression with serotonin uptake inhibitors. What used to be 95% of the time would be self-limiting, now 60% of the time results in debility. So basically, we've started managing depression with serotonin uptake inhibitors, which damage the brain of human beings that take it. They deactivate the T2 receptors, and when you try to stop taking the drugs, then you get anxiety and depression. And then you're told you have a biochemical defect, which does not exist, and that you have to be on these drugs the rest of your life. And so it's a really nasty little cycle that we've set up. What we do is we carefully help people wean off their antidepressant, anti-anxiety medications, fast them, reboot their system, and then help them work on their psychological stress issues. We do have people like Dr. Lyle, who does behavioral cognitive therapy and can help people because, there's more than just diet involved here. There's also the stress issues. But the combination of that has been effective in a significant percentage of people that are able to normalize their depression, anxiety symptoms and eliminate the need for medication that goes along with managing them.
So from your experience, does taking the selective serotonin reuptake inhibitors over time damage the brain, and is that recoverable if it does damage the brain?
Well, it's really slow and it takes a long time to recover. And he talks a lot about that in that book, that it can take sometimes not just weeks or months, but even years to help undo the damage that's caused by long-term use of these medications.
Great, thank you. And in your experience, are there any conditions or patient profiles for which fasting is not recommended? Or should we?
Oh, yeah, a whole lot. I mean, we see a whole lot more people that are not good candidates than we are good candidates in terms of screening. The people that are good candidates, as we said, are the people that have conditions of dietary excess and willing to do dangerous and radical things like eat well, exercise, go to bed on time. And the people that are not good candidates are people that are looking for magic. They want to figure out how they can continue to engage in short-term pleasure-seeking, self-indulgent behavior, but not have to pay the price. That's not what we do as any use. We don't have any magic to offer. This is all about hard work. This is probably the most difficult thing you could ask a patient to do. Adopt a health-promoting diet and lifestyle in a society designed to make them fat, sick, and miserable. And everywhere they go, people are going to try to undermine their success. And the more successful they are, the more hassle they're going to get from people, because they're going to walk in the room and create cognitive dissonance in people around them just by their very success.
Thank you. So we have about 3 minutes left before we need to wrap up. So let me ask you well, not a quick question, but the relationship between fasting and cancer is a topic of interest. Can you discuss any research or case studies that?
Yeah, well, we talked about the lymphoma and the lymphoma series, and we've been tracking a number of patients now with lymphoma. Lymphoma, we're actively treating and publishing because the conventional treatment for lymphoma has serious limitations that even if you send it into remission, it tends to come back and blow up and be a mess. And so it's not considered unethical to, get people well. And so we're able to not only get people well, but publish those cases without running into the problems where it's different than the standard of treatment, which is sometimes delusionally thought to be effective. So in this particular type of cancer, we're not getting as much problems from offering people an alternative option, because watchful waiting is oftentimes the course of care. And so we have the opportunity to actually help them get well. I think that there are cancers that are going to have much more difficult time treating. These solid organ cancers are not going to likely be as responsive as lymphoma appears to be. But, nonetheless, we're going to try to investigate as best we can within the limits of, what we're able to do and what we're able to publish. Because right now, it's not that easy doing it, but it's really not that easy, publishing about it. It's very difficult to get articles published in peer-reviewed journals just because there's so much prejudice against diet and lifestyle, let alone fasting. So we've been, I think, remarkably successful in that we have, I think, 18 or 19 papers now that have been published. And if you go to fasting.org, you can review all those sites. And I think we've done a good job, and I think we can do an even better job. And I'm hoping now that we've found some success, we'll be able to garner more interest from affiliates, people that are interested in doing collaborative research with us, and that we'll be able to be more successful in terms of fundraising and all the rest of it.
And if someone was generally healthy but wanted, and was dedicated to their health, would they be a candidate to go do maybe a shorter fast there, or whatever an appropriate length fast?
I think the people that are going to turn out to get the most benefit of fasting are healthy people using it preventatively. And that's typically going to be the shorter 5, 7, 10-day fasts. And whether they do it at True North Health Center or they do it at home, I just want people to do it right. Make sure they're a good candidate by history exam and lab. Make sure they rest when they fast, and make sure they recover properly. And if they're interested in understanding that, read our book, Can Fasting Save Your Life? And you'll understand if you're a candidate and what the protocols you and your doctor will have to go through to make sure you don't screw it up.
All right, great. And I think that concludes our time. Always a pleasure, Dr. Goldhamer. I really appreciate all the information that you shared today. So with that, if we could unmute the audience so they can say thanks.
2 hours.
Love you, Dr. Goldhamer.
That was amazing.
Blessings, everyone.
Thank you.
Blessings.
Because of the location that it is,
Gracias.
it's